Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Tom, good to see you.
Parker, nice to see you as well.
Welcome back to the Sit and Stay podcast, as brought to you by RipsyTech. Today we have yet again another episode. Today we're going to be talking about patient communication. What are some best practices? What are all of the different ways to navigate patient communication? There are actually a number of ways that you wouldn't think of, and a lot of this has to do with not just patient communication in the session, but particularly outside of the session. So, Tom, before I dive into the questions, any quick thoughts on this topic, Tom?
Yeah, and I'd say this is a very one size does not fit all type question. There's a lot of, everyone has their own style of practice, patient communication, and it's going to be presenting some thoughts around patient communication, and ultimately up for people to decide what they want to do. And so it should be an interesting conversation because of the fact that it's not one size fits all.
Absolutely agree, especially from our end, working with a lot of different types of providers. Yeah, some people have just their own particular preferences, and you kind of come to learn that based on their experiences, all of those different preferences make a lot of sense for each of them. So let's get into it. So the first question is about best practices communicating with patients outside of therapy. What types of communication have you found to be most effective in your own experience? I guess we could start there.
Yeah, and I'll, before talking about the communication piece in general, right? In a perfect setting, you're seeing your patients and treating them at whatever frequency you do, whether it's weekly or once a month, and you're answering all their questions in that session, and people are doing well, and there is not much need for communicating outside of sessions. If you've automated kind of scheduling and payment and are providing good care, the goal would be not having too many communications outside of sessions. So I think that's the first piece to just talk about. There are, historically, sometimes providers who work for large groups, for example, Kaiser Permanente here, you can sometimes be the sole provider for hundreds of different patients,
right? In
which case you're not going to be able to maybe provide that frequency or level of care you want, and they are going to be calling for help. And well, in the case of Kaiser, you connect with advice nurse or other people, kind of filter or block those calls. But for our audience, where it's people running their own groups or in private practice, being very mindful that the best way to have the least amount of communication between sessions is to make sure you're providing great care. That is the goal, of course.
Right. So with that in mind, what are some examples of different types of communication that can occur between patient and provider outside of session?
Yeah, and it's a good topic to follow our discussion of office policies, which is where you should specify the communication style. But yeah, maybe 30 years ago there was really only phone calls for communicating in between sessions, and now we get to add to phone calls there are phone calls or emails or even text messaging, which is being used. So all of those are possible communication types in between therapy sessions. I'd say that when I started out, email was definitely picking up and pretty common by the mid-2000s, though not as ubiquitous as it is today. that I actually much preferred initially to use email for communication, because the email kind of limits a finite response, versus when you get on the phone, it does become easy for patients or families to ask, oh, just one more question or just one more question. And, usually they value your provider's advice, and especially if you're not being reimbursed for your time for these communications outside of session, which is the usual case. Phone calls were less desired. But the main, right. So we've talked about phone calls, email, and text messaging. I would say that in our clinic, where we work with clients on Medi-Cal, or which is the California equivalent of Medicaid, the best method for communication is definitely text messaging. So, because, people don't generally have as much access to email and don't check their messages and listen to voicemails when you're dealing with other concerns about poverty and just making it through day-to-day life, but you can get good responses via text message. So I think that for our providers who work with Medi-Cal population, text messaging has definitely been the most effective form of communication. We've also found that for the young adult population, text messaging tends to be a good format for communication in between sessions. Again, there's general limits you want to set on what are appropriate communications.
Right.
But I think the fear that your patients are going to be texting you 24/7 if they have access to texting. I mean,
that's where my mind went.
That hasn't really materialized. Even from all levels of patients that we care for. And which is interesting. With respect to email communication, I think we referenced this in the office policy call. The danger of email is it gives someone a blank template with unlimited space to send a message to you.
Right.
And I don't think there's any harm in that one-way communication via emails, but it is not great practice to get engaged in sending very long emails back to patients or in trying to provide treatment via email.
Right, and that's something that we talked about last week about, patient policies or office policies, making sure that you're not providing care through the emails but still that tends to happen, which speaks to why it may not be an ideal method.
Right. And there are actually, there's even some large groups now that you may hear advertised that do give you access to text your provider kind of during working hours and are advertising it as sort of a treatment to have this two-way text messaging. I will say that there are some other research going on with text messaging as a treatment, and then even with AI bots being a part of on the other end of text messaging treatment. So just wanted to mention that with respect to our philosophy is not really to do that, look at those forms of communication as a type of treatment, but there are other groups or people who do look at that as a type of treatment. And then in general, it's, switching to more of a business model. If you take insurance and are seeing patients with insurance companies do not reimburse for this communication between sessions.
Right.
And so unless you have your patients sign a non-covered services agreement to bill for communication between sessions, you're not going to be receiving reimbursement from that. So it's also, from a business standpoint, minimizing communication between sessions is an important business practice.
So, well, on that topic of non-covered services, just real quick, yeah, I mean, if a patient does opt into that, I suppose would a phone call be seen as kind of like the most expensive thing to charge for, because it's almost because you're like live talking to your provider, maybe not face to face, but you have their full attention in that moment.
Yeah, it's a good question, right? And it's, for people providing therapy, there are therapy codes that kick in once you've been on for 16 minutes with your patients. And so theoretically, since you can still bill telehealth codes for phone calls, it's like scheduling an extra session if you're going to be on the phone for 16 minutes or more. So it's almost this question of, if you don't take insurance, or if you're going to have a telephone communication that's less than 16 minutes, are you going to charge for a 15-minute block there? And I think that for a lot of people in cash practices, or where you get a super bill, they do have a policy of charging for phone calls in between sessions, and that's very reasonable. We try to work very hard to limit phone calls to 5 minutes or less, and only if you need to do one between sessions. And if it is a bigger topic that is session worthy, then let's get something scheduled so that you can bill properly for it.
Yeah. Well said. So I kind of, based on something that you said earlier about the text messages, if the concern would be that a long paragraph or an essay materializes in your text inbox, and you try to set expectations or try to set boundaries with your patient, and they're not respecting that. As you said, it hasn't really quite happened, but in the event that something like that does, what's the proper way to respond to something like that?
Yeah, if it's something that's not urgent or an emergency, it would be thanks for the info, we'll talk about this on Tuesday, or hey, let's get you scheduled so you can come in and talk about it in more detail if there's nothing scheduled. I think that people certainly have gotten the text messages that are more urgent or emergent, in which case, well, and as every mental health professional has to be aware of, you are ultimately going to have to do some emergency phone calls on behalf of clients at some point. So, yeah, if you got a text message where you're concerned about the safety of your patient, you have to intervene, and that's usually calling for a safety check or 911, depending on the level of the emergency. And if that's happening, I guess the same thing for when we have to sometimes file Child Protective Services report. It's always better to communicate, hey, I'm worried about you, so I'm doing this, instead of just calling 911 or making a Child Protective Services report. It's always better to let patients know what you're doing and why you need to do it. And then you have to be ready to deal with these emergencies that we face in mental health treatment.
So far, everything that we have been talking about is, we're talking a lot about technology. We're talking about emails, text messages, phone calls, and a lot of those can be, I would say most of those, maybe except not email, would be kind of two-way type of communication. Well, before I kind of dive into two-way, one-way, all of that, is there any other technology that fits into this equation? Any other technology that providers can use to facilitate the communication with their patients?
Yeah, and there are plenty of providers that actually don't use email and certainly don't use text messaging. And then even though there's a general phone number to the practice, you can decide to do your communication via your electronic health record. Lots of electronic health records offer messaging features. And then it's a question of, do you want to just have one-way communication where you could send a message to someone's, phone, a text message, or send an email, and even just about scheduling or payment. And as we've mentioned, certain age groups or for other reasons, people, I think in general, people are most responsive to text messages. So, you can have that one-way communication through your electronic health record. You could also have two-way communication that feeds just through your health record as well, where patients can send text messages, but they don't go to a phone. They maybe go to your EHR inbox. And similarly, instead of having an email that goes to a practice-run email account, it just goes in through your electronic health record. In which case you want to make, again, for any sort of email or other communication you're going to allow patients to have, you want to set the expectations around responsiveness for that, and make sure that that's clear with your patients. And I think, like we talked about last week, it is interesting to see the preferences of different providers, and some people really have it set up so there's essentially no communication between sessions,
right?
And depending on your situation, that might be appropriate and okay.
So let's dive into that then. What there seems to be benefits and potential the word is escaping me, non-benefits, pitfalls maybe that could happen through either form of communication, one way, two way. What might some of those be, and how might that potentially impact the therapeutic relationship that you have with your client?
Yeah, I think we've talked about this. I don't know if we've actually talked about this, but the most important predictor of anything bad happening in treatment is a relationship where your patient feels like you're not attentive or listening to them, and essentially that you don't care about them. So, if a patient has been sending a lot of text messages, but they're just going to your electronic health record portal and you're actually on vacation, and although you set a reminder on email, but you didn't set any sort of update through your EHR, if a patient thinks you're ignoring repeated questions and comments, you're going to damage that clinician-patient relationship. And that's probably the biggest concern with any form of communication, that you haven't set expectations properly. People are expecting to be able to reach their clinician, and if they can't get a hold of you, that's going to damage the relationship and the treatment that they're receiving.
Okay, so in this case, we're talking about sending a two-way message through an EHR. So then, why might somebody decide? Well, we've kind of touched on it, but why might somebody decide that one-way communication where maybe they don't want patients to be able to email them. Maybe they don't want them to be able to send them messages on their EHR. Maybe they don't want to text them. They just want their patients to call them. Why might somebody, choose that as the best method for them?
Yeah, I think people who are very busy and packed schedules and then don't have time for a lot of extra admin work or even checking messages, if you set the expectation that treatment happens within appointments, and there always has to be some mechanism for emergency situations, and if you keep that to being, if there's an emergency, call this number, and then almost everywhere there needs to be the message that says if it's life-threatening, hang up and dial 911. But
right.
Then you otherwise leave a message and it will be checked and someone will get back to you within 24 hours. that helps screen out most items that probably really aren't urgent or emergent. So it's a lot more effort for someone to call a phone number, listen to a voicemail, and leave a message versus sending a quick text or email about something.
Right. And in that case, that's a really great point, because in the case of sending that email or sending that text message, they're not going to get an automatic message back saying, like, if this is an emergency or if this is life-threatening, call 911. Whereas, if you call pretty much any mental health provider on the phone and you go to voicemail, that's the first thing that you're going to be hearing. So that's right. That's a really great point.
Right. Yeah, even for, regular primary care practices and such, they all sort of tend to have the same message. If it's an emergency, call 911 or go to the emergency room.
So when it comes to talking about that, establishing that protocol of communication with the patient, what are different conversations or ways to, like, are there, we talked about, like, you really kind of should clarify that at the top of, first seeing this patient, like, what kind of communication to have with them. I mean, are there established protocols that you have to follow? Are there protocols protocols may not be the right word, but is there a right way to go about this? Maybe my question, and what are those right ways?
Yeah, no, good question. And then there's this question of what is legally required.
Yeah.
And speaking from the state of California, it is not actually legally required for you to have 24/7 phone support for your patients. You do have to have a number they call that has that emergency message and that can give information about how soon someone will call you back. But you don't need to have, 24/7 answer your phone with respect to being legal from a state level. That being said, there might be an insurance that you've taken that you may not be aware of, that part of the stipulations in your long 80-page insurance contract are that you do have someone who the patient can get to 24/7. And I think that's something that's always important to be aware of. Sometimes those contracts include these clauses that are meant more for primary care or medical clinics and less for mental health, but nevertheless they're in your general contract with an insurance company. So make sure that you're aware of those stipulations if you're working with any outside provider, any outside entity, insurance company, government agency, any other group that you might be doing work with.
So as a provider, you might have a contract with an insurance company or be working with any outside entity that might have requirements of you that to have access to either a phone or any one of these things that we're already talking about. Is that
That's
fair to
correct.
say?
Yeah.
Go ahead.
Oh yeah, but the right, ultimately, I think we talked about a little bit, right, when you start with your patient or you've done an assessment, it seems like a good fit, you just want to be very clear about what type of communication is okay. And I will say, there is another type of communication we didn't talk about, and this happens often for patients who have therapy homework between sessions, or at least what we do in our clinics now. Mm-hmm. What you used to be, and many people still do, is giving a paper or a worksheet to maybe log some situations or thoughts or feelings or exposure therapy. I definitely have switched to using HIPAA compliant Google Sheets, which is a very nice way to give people a log that they can access on their phone. so that in the moment, if they're supposed to be writing down events or whatever therapy practice they're supposed to be doing, we get much better compliance if they can just pull up their phone quickly and do the documentation versus, people aren't going to carry around the paper and clipboard. And if you're asking them to fill out a paper form each night, it's not going to be as good data as in the moment. So theoretically, on some of these homework forms, people could type in something alarming that needs to be addressed. But I just felt like it was worth mentioning that we do have a lot of patients with access to these shared Google Sheets for tracking moods and thoughts and situations and exposure. And that's worth a conversation as well.
And that's a good way for you to also track if they're engaging with it or not.
It's, a lot of people don't know about, you can view the history of the document and see when they did their entries. And, if someone's supposed to be doing a rating scale daily for 7 days, and then you notice that,
all those ratings came in right before the session.
It's helpful to know. I mean, you can have a conversation about it, or maybe the homework you've assigned for your patient isn't the right type of homework. But
yeah. All right. Well, I had a fifth question here, but I think we've covered it. It was about handling sensitive and urgent patient communication outside of a session. I think we've about covered that. So, anything else to add on this topic?
I think, big picture is figure out what communication preferences you have and that are easiest and less stressful for you. Communicate that clearly with your patients. But in general, if you're getting lots and lots of communication between sessions from a patient, then it's a good opportunity to reevaluate what's going on with the treatment, because it's something that in general shouldn't happen a lot.
Understandable. And I do like your point about the speaking from experience. I've been late to sessions before. If I could just text my provider to let them know that I'm late rather than sending an email from my phone at a red light, which I certainly have never done before. Wink, wink. But that certainly would be an easier way to communicate, and especially I've been late to dentist appointments where it's, in that case, it's something that you've scheduled this 6 months in advance. You don't want to lose your appointment, but you're running late. I will say it's been a little bit of a pain to try and call the dentist office just to be hit with a call tree at a red light. Not the most convenient thing, but I agree. And if you can always be selective about your patients and who you're going to allow to text with you or not. So that's, a fair comment as well. And depending on if you're working for a group and there's specific policies, that may not be true. But if you're running your own practice or it's a small group, most people probably know who it's okay to let text with you, and right.
And who maybe that you don't want to share that number. But
all right, so on that note, I think maybe now might be a good time to transition into our mental health business moment.
Yeah. And let's talk about I'm going to talk about malpractice insurance a little bit, because this is what drives this business moment. So during the pandemic, a lot of laws about practicing across state lines and what malpractice would cover were loosened, which was great. But that has ended. And at this point in time, it is, if you're not licensed in another state, you're not covered if you're providing care or treatment to someone outside the state that you're in. And this is an example where the law is off sync with what is providing the best care to patients. And I've had a couple patients who are, and if you treat college students, or, even if you're treating local families, but they need to be out of state for other urgent or emergent situations, with technology where it's at with telehealth sessions, to me, it's very logical for care that for most people, there's probably a way to continue care with someone that's known to both people and the history and hey, let's just do telehealth sessions for the next few weeks. But it is it is illegal to do that right now. And so if your patients are away for the summer or going out of town for a month, it just feels frustrating when you could keep moving forward with their treatment, but instead it's a big, hey, we have to pause and can't do anything till you get back, which we know leads to, return of symptoms, regression of treatment. It's a lost time to make progress. And it's frustrating, and it feels like one of those things, along with 70-page consent forms, that there's a lot of legal stuff that's happened and is built in that just has quashed this. But in reality, the best care for the patients would be to be able to continue to provide care and not making it require you to be licensed in another state and have a malpractice policy that covers multiple states. And so that is the frustration of the week.
And I can imagine, as a child and adolescent provider, that especially during the summertime when a lot of patients might be going on vacation that is across state lines, that becomes a major inconvenience, and sometimes a little risky.
It does, and it's still, patients that you're doing telehealth with may be in a different state and you're not even aware of it. I think many larger institutions have, in their pre-appointment screening or questionnaire, they make sure that you're in the state that your care provider is in, as a question to help protect themselves from any sort of future legal issues. But
makes sense. All right. Well, it's a very relatable moment. As somebody who has gone on his own vacations and been a patient for a provider before, or been a client, it's certainly, it just happens. So yeah, very, very relatable, I think, on both ends. With all of that said, I think now would be a great time for us to wrap up. I think we got a slightly shorter episode today. I think we successfully tried to keep it a little shorter. But as always, if anybody listening would like to submit questions for an audience Q&A, you can submit your questions to sitandstay@RipsyTech.com. And if you are interested in being a guest for our show, go ahead and send us an email there as well. And we'll, if it's the right fit, then you never know what might happen.
Very cool. Very good.
All right. Have a good one, Tom, and I'll see you next week.
Thanks, Parker. See you soon.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.